In this video, we're going to go over just some general event guidelines for working special events. So the first thing we have to talk about is event sheets. Make sure you have an event sheet filled out by a manager prior to each shift. If you don't have one, you must call the on-duty supervisor. The event sheet is super important, and therefore it's a violation of company policy if you don't have one. So please make sure if you don't have an event sheet, call somebody, let them know, hey, I don't have one. All right, moving on to professional appearance. So as a reminder, you represent the company. Our clients are looking to you, and therefore we want to make sure we maintain that professional appearance at all times. So with that, we want you to show up to work with a clean uniform. We want you to have your shirt tucked in, your boots polished, and proper hygiene at all times. This means that you shower before work, you brush your teeth, you comb your hair, and you look presentable. Males, clean shaven or neatly trimmed beards. Alright, so when you get to an event, you want to go ahead and do a few things. First of all, you want to check in with the client or the event contact. Let them know that you are on site ready to provide excellent patient and event care. You want to go ahead and document the appropriate times on your event sheet, and you want to figure out a few things. First of all, you want to figure out where they're going to have you stage at. And then also too, what is the communication plan? Oftentimes, the communication plan involves exchanging of phone numbers, so that way the client can get a hold of you if needed. Other times, it may involve getting a two-way radio. Now, what happens when you depart the event? So you're only allowed to leave the event once you're authorized from the client, meaning that although an event may end at a certain time, there's a possibility that the event's going to be held over, or that the event got released or ended before the contracted time. So we want to go ahead and make sure that we confirm with the client that yes, you are indeed allowed to leave. And then we want to make sure that we document all appropriate times and get the signature on the event sheet. So what can you bring to work, or what should you bring to work with you? So first of all, once you obtain your ambulance attendant license, you must have this with you at all times when you are working on an ambulance. Also, you want to bring any personal medical supplies, such as like a stethoscope or a flashlight. I carry both with me. In addition, you want to have food and water. There's a good chance that the event is not going to have food and water for you, especially ones that are out in very rural areas. Therefore, make sure to pack a lunch, bring a water bottle, so if food is not readily available, you're not sitting there starving all day. And lastly, what you want to bring is something to do, such as like homework or a book or something low-key, but something that will keep you occupied. As a lot of our shifts, you end up sitting in a room or in an ambulance for hours on end, staring out the window or watching paint dry. So we're going to do a quick case study here. So this is a case study of a crew that was sitting at the Las Vegas Convention Center at about 1300 hours. The crew got a little bit hungry, so they went ahead and left the convention center for the Capriotti's in Paradise and Harmon. Their total time away from the event was 30 minutes. They had a Las Vegas Convention Center radio, and they also checked out with dispatch and told them they were leaving. So what are some problems you see with this case study? Well, one big problem I see is that the crew is not at the event. They have left the property. So we cannot leave the property of our events. You have to remain on site at all time. So was the crew able to respond to an incident if something would have happened? They were about 15 minutes away. It would have been quicker for the client to call 911 than it would be for our crew to respond. So how could the crew prepare better for their shift? I think you guys got it. Bringing a meal to work. So just some general event rules, a few things to keep in mind while working events. First of all, there is no sleeping at events. You want to make sure that you arrive on time. You do not want to partake in any of the event activities unless invited by the client, and this does include eating food from the event. We do have some really fun events, some really cool events that are completely down with letting us jump in there and getting involved and being part of their event and letting us do things that the participants do. Other events, they want us tucked away in the back, kind of out of sight, out of mind. So just big thing is just be in tune with the event and what the client needs. And then also to help out if needed. So we are encouraged to help out at events. In years past or previous events, we've had employees that will help clean up garbage or help clean up a race course or hand out waters or collect tickets. Help out, provide a hand whenever possible. However, it's important that we don't let these functions get in the way of providing the medical care and what we're basically contracted to do. We don't want to let those activities get in the way of events. Now, it's important that you arrive on time at events. We don't want to be late because a lot of our events are required to have an ambulance or medical at the event before their event begins. Therefore, if they can't start their event if we're not there on scene. So we want to make sure that they are not starting their events late because of us. So let's talk about assessing patients. Assessing patients at events is a little bit different than in the 911 setting, which oftentimes is what we're trained for. So these differences will oftentimes include the level of acuity, the needs, crowds, noises, available time with patients, and an extrication from the event and resources. So when we talk about level of acuity, one of the big things in EMT school is that people are trained in, or EMT programs train in like worst case scenario, and you'll get all these critical patients in training. However, the majority of patients that we're going to interact with are going to require very minimal assessment and very minimal resources. It's going to be something simple like a Band-Aid or an ice pack or some kind of comfort care items. However, we do interact with patients that do have a significant medical or traumatic complaint. Now, when we talk about patient needs, okay, their needs can be anything. Their needs can be from something as simple as needing to pump their breast to take care of their newborns, to basically seek refuge from the event for treating a common medical condition. If we get these people our first aid rooms and our areas are open to help them out. So our job is to assist these individuals with their needs to the best of our ability. So this is just previous outline of patients that have had needs before. We've had patients come in where mothers need to pump their breasts. We've had males come in where they need to place a urinary catheter. We've had people come in that need to set up their SVNs, or mothers that want to put their breast milk in our first aid refrigerators to keep it nice and cool. So these are all real calls that we've dealt with. It's basically our job to help them out and assist them as needed. And most of these times, if we don't interact with them, we just kind of give them a spot to kind of hang out. We don't really have to put them on the patient log. Now, moving on, talking about crowds and noise. So large crowds and noises can hamper the patient assessment process. And usually we're working concerts or conventions or areas where there's a lot of people, a lot of commotion, a lot of things going on. So if possible, we want to remove these patients from the crowd and loud noises in order to assist with proper patient assessment. Now, time with patients. So when we talk about time spent with patients, we don't want to spend a lot of time with individuals. We want to go ahead and do as much as we can in a short amount of time. So ideally, we want to limit our interaction with patients to about 15 minutes. And within about 15 minutes, we should have a clear plan as to what's going to happen. Are we going to AMA these patients? Are we going to transport them? Are we going to refer them to a clinic? And the reason being is that we have to remain available and we want to make sure that we're clear of these patients as quickly as possible. Because what ends up happening is that sometimes we get multiple calls for service. So we don't want to sit there on scene for an hour or 2 hours with a patient to figure out what the plan is. We have to get these patients assessed and treated and referred out as quickly as possible. So just some general guidelines when dealing with patients. Have a plan. All right. You should know very quickly what you're going to do. Are we going to AMA? Are we going to transport and call those resources in early if needed? We also want to go ahead and keep this in mind of what our job is. So our job is rapid assessment, stabilization, and referral to an appropriate facility. Not all patients are going to need to be transported, but we want to make that transport decision early in the assessment process if it's needed. So here's a case study from an event that we had. We had a 21-year-old female walk up to an ALS crew complaining of nausea, vomiting since 3 o'clock that day. It's about 1400, so 11 hours later. Patient has no medical history, states she can't keep anything down, vitals are stable, as evidenced on the screen. So what would our treatment plan be? If it were me, I'd figure out what she wants to do. Does she want to go to an ER? Does she want to go to an urgent care? Make those recommendations. Instead, the crew went ahead and treated the patient. They got vital signs. They gave 4 milligrams of Zofran IV. They went ahead and infused 1,000 cc's of normal saline. And they went ahead and spent over an hour of time treating and assessing this patient, only to figure out they were going to AMA her. During this time, they were not available to respond or treat other patients. So we see here they spent way too long on the scene, and then Zofran, we want to make sure it's cardiac monitored. So, with that, we want to go ahead and have that patient transported to an appropriate facility. It's important to note that any patient who receives an invasive ALS procedure, such as IV medication, IM, or sub-Q or intranasal injections, any advanced airway procedures, defibrillation, they must be transported to the hospital by ambulance. Remember, our job is rapid assessment, stabilization, and referral to an appropriate facility. Key word there is rapid. We want to be very quick in what we do. So big thing is have a plan. All right. So this is kind of an outline of a plan that you might have, something to keep in mind. So you respond to a call, we get on the scene, we do an assessment, and from that assessment, we should figure out what we're going to do. Are we going to transport? Are we going to AMA? Then we want to go ahead, and if we're not quite sure if we're going to transport or AMA, we can go ahead and do a further evaluation, maybe consider moving the patient into a quieter environment, such as the ambulance or the first aid room, come up with that determination. Is transport needed? If they are, go ahead and call for transport. If not, do that AMA and refer to an appropriate facility. And then we also want to take a look and see, did we do any invasive procedures? If we did, then we want to go ahead and transport that patient out to a facility. So when we talk about extrication, oftentimes patients should be extricated from an event to protect their privacy. We want to do our best not to allow outside EMS agencies from entering the event. We want to take them to EMS if possible to protect the image of the event, but not always possible. EMS or outside EMS agencies do come in to the events for various reasons. Now, when we talk about available resources at events, it's going to vary. Different events are going to have different things. Some events we have a single EMT, other events we have full ALS crews. It's important to note that no two events are alike. So equipment may be limited at the event. So we want to make sure that we're conserving our equipment and supplies as needed. In other words, we're not just handing out supplies. One of the biggest things I see is people hand out Band-Aids. Somebody will come in and be like, hey, can I get 10 Band-Aids? Yeah, here you go, here's 10 Band-Aids. But yet we only carry like 20 to 30 in our bag. So we want to make sure that we're limiting supplies. Another thing where we see a lot of supplies that get burned through is gloves. Somebody walks in, first thing an EMT does is put gloves on, right? When it's nothing more than just handing out a Band-Aid saying, here you go, and the gloves really were not needed. So keep in mind that you do have a limited amount of supplies at events. If you do need more, definitely call the on-duty supervisor. Let them know that you're running out, but at the same time, make sure that you're conserving what you have on site. And then we want to go ahead, if we have our patients, we want to make sure that we refer them to an appropriate facility. So this might include an emergency room, primary care physician, or an urgent care. We do have a list of facilities that you can hand out to patients to help with them get to an appropriate facility. If you have any questions, go ahead and make sure that you call the on-duty supervisor.